Lastly, I want to talk a little bit about rehab because you're a physical therapist, right? You got to give them a little bit of rehab program. So think about the type of injury that they had. So for one, you probably want to let that area scar down a little bit. Fortunately slash unfortunately, if you are a younger individual, chances are you want to get back to higher level stuff, right? And that's a little bit more of a challenge just because you're probably going to get yourself into a position that's similar to how you hurt yourself in the past if you're doing a contact sport, right? The other piece is that the type of collagen that you lay down as a youngster is a little bit different than collagen you lay down as an older individual. So if you're 40 plus and you have a dislocation, then that's probably going to scar down a little stiffer than if you're 20 years old and you have a dislocation, right? So for the older folks out there, it's usually one of those things where, all right, well, we probably don't need to do surgery, probably just because you're older, you're probably going to get stiffer. You're not trying to get back to rugby, right? So let this scar down a little bit and we'll get you back to your activity slowly over the course of time. If there's a lot of instability you're noticing, then you can consider surgery at that point, right? So we also want to really focus on dynamic stability of the joint, right? So if you lose some of the capsular restraint within the shoulder joint, or if you really stretch out some of those ligaments, then what you have left to control motion within the shoulder joint is going to be the rotator cuff. So I think you want to put a lot of emphasis on strengthening the rotator cuff in all different positions, especially eventually the positions of instability. So if you have instability in the front of the shoulder, maybe initially we're doing things like sideline external rotation and we're doing internal rotation with a band, elbow at the side, but eventually we work our way towards doing more 90-90 external rotation, internal rotation. Because at the end of the day, we need stability here. This is the position where we're lacking, capsular restraint. So we got to build that back. All right. Just make sure you don't push it too early because you can end up with some problems, right? Let the scar down a little bit, build some strength, some dynamic stability there. So what I generally do is I do a rotator cuff strengthening program, starting with mid-range exercises and eventually progressing towards end-range exercises. And I usually do this 3 times per week, right? Let's say 3 exercises. And I continue having them train the way they normally do in the gym. Now, if they normally don't train in the gym, I just write them an upper body strength training program. And then I put accessory rotator cuff strengthening on there, which starts with mid-range and progresses towards end-range motions over the course of time. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.